COVID-19 is taking a tremendous toll on our nation's physicians and those all around the world. We have heard the tragic stories of emergency physicians in New York, one of whom actually took her own life just a few weeks ago.
Joining us tonight is the president of the American Medical Association, Dr. Patrice Harris. Thank you so much for joining us, Doctor.
Oh, thank you for having me.
Well, Doctor, we often look at physicians and EMTs and nurses and all of those people as being superheroes, and they certainly are. But they have feelings and needs and emotional impact as well, and it's taking a toll on all of them. How do you counsel those folks?
Yeah, there's no question that physicians, all healthcare workers on the front lines, are suffering from a huge emotional toll. And, you know, I can tell you that as physicians, oftentimes we put ourselves last and make sure that we care for others first. And so we are telling physicians, the AMA is telling physicians that during the midst of this pandemic, absolutely take care of our patients, but don't forget to take care of yourselves. And we are also encouraging systems and hospitals to make sure they have wellness rounds and resources available for all of those workers on the front line.
Is there any way that we as public citizens who aren't in the medical profession, anything that we can do to assist those who are on the front lines?
Absolutely. And although people might not make the connection by wearing face coverings, by slowing the spread, by keeping 6 feet apart, no large gatherings, that helps. That means that there are no surges in our emergency departments. That means that there are no huge influxes of patients. And that really does help physicians. So it may seem like a very simple thing to do. It not only protects everyone, but they are absolutely protecting physicians and other healthcare workers on the front lines.
And Dr. Harris, we hear all these wonderful stories about, flyovers and all the tributes that people are putting together to kind of boost the morale of physicians. But I remember reading a story the other day where our physicians in the United States are the 8th, not first, number 8 as far as pay scale is concerned. What can we do to encourage people to get into medicine and going forward now I'm talking about? Not right today, but going forward, how we can encourage people to pursue your profession.
Well, certainly I am biased, but I think it is absolutely the greatest profession in the world. I mean, you really get to bring a passion for caring and healing others. Now, certainly many physicians, and by the way, physicians do, again, relatively speaking, okay financially, but you could certainly go into business and make much more money than you could have as a physician. But to me, it is a wonderful and noble profession and well worth the sacrifice. But that being said, I do hope, and I think now I have to say, that everyone is aware of the hard work and the dedication and the sacrifice and the many years that physicians spend in order to give the best care to our patients.
Dr. Harris, this is a crisis, a health crisis that America has never seen the likes of before. Are there enough properly trained and professional doctors to handle the possibility that things could get even worse and become even more of a huge crisis? Are there enough health professionals in the system to deal with what's happening and what could possibly happen even worse?
Well, that's a great question, and really on two areas. Physicians were already suffering a huge crisis around physician burnout. Okay, so that existed pre-COVID. Also, there were certainly workforce shortages. I am a child and adolescent psychiatrist, and there certainly is a huge shortage of child and adolescent psychiatrists, actually psychiatrists in general. So we have been at the AMA fighting for more residency slots. Over the last couple of years, we've had more medical school positions, but we need the next level. That's what you do after medical school, what you do to train for your specialty. That's called residency. We do not have enough slots. It's mainly funded by Congress, so the AMA has been advocating for years for an increase in the number of residency slots. And maybe we should look at some additional ways of funding that, but that has been a long-term advocacy area for the American Medical Association.
And doctor, before we go, I remember hearing all these heartbreaking stories, we both have heard them, about doctors in New York and elsewhere who have been working these crazy hours and working with patients who are dying, and they can't even go home for fear of taking COVID-19 back home with them and infecting their own families and having to stay in hotels. That kind of stress, how do you counsel those folks?
And that does add to the toll. One more point I did forget about the shortages. As you know, physicians are becoming ill working on the front lines. And so for every physician that is not able to work on the front lines, that only adds to the shortage. And of course, early on, I'm sure you heard many of us talk about the need for personal protective equipment. Certainly we are better today, in a better place today than we were at the beginning. But in the beginning, physicians did not have enough equipment. They were reusing equipment when pre-COVID. Though reusing that equipment would have been a violation of a hospital's infection control policy. So again, that is part of that emotional toll. Physicians worry less about themselves, candidly, but also bringing home the infection to their families, and that just added to the heavy burden and emotional toll on physicians. And so, again, we appreciate everyone doing everything they can. We called on the administration to make sure that there was enough equipment by invoking the Defense Production Act. Of course, we need that for testing as well. I do also want to say, while I'm on your air, we were talking about physician shortages. We certainly need more physicians of color. That was one of the areas that I wanted to amplify during my year as AMA president. And the AMA will continue through our Center for Health Equity work to increase the diversity of the physician workforce. As I said last year at my inauguration, we didn't make sure that the faces of our physicians match the faces of our patients.
Dr. Harris, wonderful information, and we do appreciate everything that our physicians and all of our healthcare workers do. Thank you so much.
Thank you. It's been a pleasure.
Thank you.